Hi, I'm Kenneth Acha. I do videos on health, relationships, and Christian life. In this video, I'm going to be talking with you about generalized anxiety disorder. Before we get into the content, I'd like you to take a moment and subscribe to this channel so that you can continue to get content like this sent to you when I produce it. Thanks again for supporting this channel with subscribing, liking, and sharing. Generalized anxiety disorder is something that is particularly special and important to me because it's a condition that I have had for many years, including panic attacks. In a future video, I'll be telling you how I dealt with my own situation without having to take medications. And that's one of the things that I will be suggesting and teaching you. But obviously, medications are always available. I prescribe medications to my patients among other types of treatment, and we'll be talking about treatment in a different video. In this video, I'll first be presenting you 10 things that I think you need to be able to understand generalized anxiety disorder. And after that, I'll discuss with you how I diagnose and treat this condition in my patients. Understanding generalized anxiety disorder, 10 things you need to know. The first thing you should know is that Generalized anxiety disorder, or GAD, is one of the most common mental health disorders in the United States and around the world, and is characterized by excessive and persistent anxiety and worry that occurs on more days than not for at least 6 months. Second, people with generalized anxiety disorder typically worry about different ordinary day-to-day situations and activities across multiple domains such as performance at work, school, finances, and health, and have a very difficult time controlling their worry. Third, the anxiety and worry cause significant distress or functional impairment and is associated with 3 or more of the following signs and symptoms. I created a mnemonic Christ to help me remember these symptoms. C stands for concentration problems. These people have a trouble concentrating. H stands for headaches and muscle tensions. These people often have headaches and muscle tensions. R stands for restlessness. And then I stands for irritability. These people are very irritable. Then S stands for sleep disturbances. These people have trouble falling asleep, staying asleep, or getting enough rest when they sleep. And the last letter, T, stands for tiredness or fatigue. These people are usually very fatigued. I created this mnemonic Christ to help me remember these when I talk with my patients or when I use it, because to me, when I have any of these symptoms, it's a reminder as a Christian to cast my worry and my anxiety on Christ, who is happy to bear them for me. The fourth thing that you should know is that before we diagnose anyone as having generalized anxiety disorder, we first have to exclude other conditions that can also cause anxiety and worry. Conditions such as substance use, drugs, for example, street drugs that people use. We also make sure that people are not taking any medications that could cause these side effects. We evaluate them and order labs to make sure that they don't have medical conditions like hyperthyroidism, carcinoid syndrome, pheochromocytoma, and others that can produce this same symptoms. We also look at the fact that these patients don't have other disorders, other mental health disorders that could be causing anxiety symptoms such as panic and social phobia and things like that. The fifth thing I'd like you to know is that generalized anxiety disorder is twice as common in females as it is in males. Number 6, it is also associated with unmarried status, lower education level, poor health, and also occurs in people who have high levels of stressors present in their life. The seventh thing to remember is that it is often associated with major depressive disorder and panic disorder. The eighth thing to remember, genetic and environmental factors are involved in causing generalized anxiety disorder. The ninth thing, there is some evidence that people with generalized anxiety disorder have chemical imbalance of neurotransmitters in their brain. The 10th and final thing I want you to remember is that some evidence exists to suggest that patients with generalized anxiety disorder may experience persistent activation of areas of the brain associated with mental activity and introspective thinking following a worry-inducing stimuli. Now, let's go to the second part of our discussion. How do I diagnose generalized anxiety disorder in my patients? In my office and in many offices around the United States and around the world, we use a validated patient form or tool called the GAD-7, GAD-7 for Generalized Anxiety Disorder 7. This form has 7 questions that the patient completes prior to seeing me. Before I see a patient, my nurse's assistant or my nurse would have seen the patient and handed the patient this form. The patient completes the form, and by completing the form, the patient is helping me be able to work with him or her to make the diagnosis. Let's take a look at the GAD-7 and I'll show you how I evaluate the form, interpret it, and then I'm able to diagnose generalized anxiety disorder from there. To complete the form, the patient is asked how often have they been bothered by the following over the past 2 weeks. For each question, they have 4 choices: not at all, which is equivalent to 0 points, several days, which is equivalent to 1 point, more than half the days, which is equivalent to 2 points, nearly every day, which is equivalent to 3 points. They'll have to choose one answer for every question. The first question on the list is, have they been feeling nervous, anxious, or on the edge? That's over the past 2 weeks, and they'll choose an answer. The second, not being able to stop or control worrying. They'll choose another answer. Worrying too much about different things. They'll choose an answer. Trouble relaxing. They'll choose an answer. Being so restless that it is hard to sit still. They'll choose another answer. Becoming easily annoyed or irritable. They'll choose an answer. Feeling afraid as if something awful might happen, and then they'll choose an answer. If a person chose 3s on every question, the total will be 21. That's the maximum you can have. And the way that we score this is that 5, 10, and 15 are cutoffs. If the score is from 5 to 9, the patient has mild generalized anxiety disorder. If the score is from 10 to 14, the patient has moderate generalized anxiety disorder. If the patient has a score of 15 or higher, they have severe generalized anxiety disorder. That's how I understand and treat generalized anxiety disorder in my patients. If you think you have generalized anxiety disorder, I encourage you to talk with your primary care doctor and get the care that you deserve. If you have any questions that you think I may be able to answer for you, please leave them in the comments below. In an upcoming video, I will discuss how we treat generalized anxiety disorder. If you're not yet subscribed to the channel, I encourage you to go ahead and subscribe and also like and share this video so that others might benefit from it. Until next time, God bless. I'll see you in the next video.